Hello? Hello? Ayan. Naririnig niyo naman ako, no? Sorry, apologies. Nag-relocate lang. You can hear me? Can you hear me? Okay, that's good. Kamusta? Yung hindi ko lang sure kung ito ba ay yung class na nagbigay na ako ng lecture on SDH. Sa inyo yan, no? Kayo ba yon? Or different batch na to? Okay. So, ayun, SDH pala yung yung naging lecture ko sa inyo before. Pero hindi pa ako nagturo sa inyo ng health econ. Hindi pa. Okay. Sige. Is it okay na let's proceed with trying to see tawag dito? Trying to see what we need to to cover for this quick discussion or quick review on health econ. Pwedeng malaman kung ano yung mga agam-agam or mga nalaman nyo na with regards to health econ, ano yung mga nabigay na sa inyong lectures. So, 2 questions, no? Ano yung pwede nyo sagutin kung ano yung nabigay ng lecture or ano yung hindi nyo pa naiintindihan? Anyone? Anyone? Just to guide me what we need to cover for this discussion. Hello? So sige, May, from your end, ano na ba yung yung common issues ng mga students with regards to health econ? At saka kung ano na yung na-cover pa nila in terms of discussion? Okay. Oo. Pwede natin tawagin ang presidente ng batch. Sino ang president ng batch? Hindi ka ba Maita? Kasi si Maita ang hindi ko wala kung ano.
Ay Doc, kung pwede po
Sure.
Yeah. Diba po, hindi rin po kayo president, si Ma'am Wendy po yun. Hindi,
Si
actually,
Wendy.
opo, we requested the review class kasi nga po kami po yung na binben the past 2 years. And nung kinausap po kami nung December, we were told na ngayong January na po yung aming kompre. So, ano nga po kami ngayon, very anxious kami kasi since matagal na po yung naging lecture niyo, iba nga ho, halos hindi na namin matandaan. And hindi po kami confident actually kung ano rin talaga yung itatanong. Kaya hindi kami makasagot kasi wala rin po kaming historical basis kung ano po ba itatanong sa amin sa exam, if it's going to be a practical application ng mga tinuro niyo pa sa amin, or kung yung po bang questions na ibibigay is strictly related dun sa slides po na itinuro sa amin. Parang medyo rin po kami doon, nangangapa din po kami kung which of those, if it's going to be something na very technical na use. Kasi po, from the previous batches, may nagsasabi na meron daw nag-matching type, meron daw mga nag-fill in the blanks. May mga iba naman po na ang sinasabi, essay po yung questions na yung more of practical. Kaya nahirapan din po kami magsagot kung ano yung mga kailangan i-review kasi blinded po kami doon kung paano ho yung magiging kompre ito.
Okay. Sige. So sige, I think that's very useful information na rin naman. Pero sa naalala mo, ano yung mga naging ano nyo, so far yung na may nag-chat dito, no, yung economic evaluation, mas gustong maintindihan kung ano ang econ eval. Tapos kay sabi ni Jazel, no. Tapos Jazel, meron ka pa bang ibang naalala na mga ano yung mga lectures na nabigay na sa inyo?
About Doc dun sa market failure, what is health economics, parang ganun po. And then yung mga allocative efficiency, like something like that. Yun yung gusto ko pang ma-review, Doc. Thank you.
Alright, sige. Okay, sige. Let's start muna with I'll take the cue from Jazel and also from Christy dun sa mga nabanggit nyo. In essence, no, I don't know kung ano yung mga magiging tanong nila sa health econ kasi on this part sa batch niya yata hindi ako yung nag-handle ng health econ, pero at least yung course namin nila Dante at saka nila Denise, essentially we are using the same the same materials or parang parang the same blend of topics, dahil nung napag-decide na namin it has to fit within the context of Philippine Universal Healthcare Law. Kung paano natin titingnan din ang importance ngayon ng topic of health economics. So, sa health econ, yung the way we structure the lectures and ay magsisimula tayo with the health system performance assessment. Yun yung namin, yung unang discussion natin na kung saan inilalatag namin sa inyo yung yung 6 building blocks and how should we be looking at the building blocks as it performs as it would perform to achieve the impact and the outcomes of a health system. So of course, very familiar na kayo with the 6 building blocks and also the intermediate outcomes, the AQEE, di ba? The access, the quality, efficiency, efficiency, effectivity, and also efficiency, equity, and also ngayon resilience is being added for the outcomes of a health system, no, the impact or the outcomes of a health system that is being recognized globally, no. So ano ba yung health system outcomes natin? It's responsiveness, better health, and also financial risk protection. So the 6 pillars, which you all know, has to be delivered in a way that it is able to achieve the intermediate outcomes that the health system wants to achieve, access, quality, equity, and efficiency, and resilience. And then this redounds to the 3 major outcomes of the health system. Now, bakit mahalaga yon to start with, no? When we discuss health financing and health economics, yung health system performance discussion alludes you doon sa discussion nyo for financing, no? For you to understand what health financing is and what are the components and the topics around health financing that needs to be understood, di ba? Diyan yung nagdi-discuss na kayo ng pooling, allocation, things that will be discussed by Denise, no? And I think na-review na yata sa inyo ni Denise. And once you have that understanding of financing as a pillar of health system, health system of health systems, for it to perform, i-divert naman natin ang attention ninyo to a very critical topic, no, around finances, which is scarcity, no. And scarcity is something that drives the very fundamental nature of economics, no. Kung bakit tayo kinakailangang mag-decide over resources so that we are able to achieve the outcomes of a health system. Yun yung mahalagang maintindihan, na even with scarcity, you should be able to achieve outcomes for as long as you are able to understand the economics of a health system. And yun yung magiging natin, pasok natin doon sa discussion of health economics. Na any health system will always have limited resources but abounding need for healthcare. Walang katapusan ng need for healthcare pero limitado ang resources. So how do we now make decisions? And that's the reason why economics is always tied hand in hand with governance. Kasi governance is decision making, economics is understanding resources and scarcity and how to make decisions on allocations to achieve outcomes. So economics and governance of health systems is essentially yung nagiging cover ng buong lecture ninyo. And I'll be using the slides that I have now para medyo ma-review lang sa inyo, ma-refresh sa inyo kung ano yung mga konsepto around health economics. So far, so clear? So far, so good? Na nagagamay ninyo kung paano yung structure na naging lecture. Alright, that's good. Sige. Share. Nakikita niyo yung slide? Sorry, hindi ko kayo nakikita kung nag-okay sign kayo dahil naka-project ako. Please speak up. Nakikita niyo?
Yes po.
Okay. Sige. This lecture, ito yung for the initial run ng HD nung ginawa namin siya. And hindi naman na obsolete yung topic around it. So, okay. Sige. So, dito sa quick lecture na gagawin natin, so, pakwento lang yung gagawin ko, no? So, sa apologies kung medyo mabilis yung magiging daloy ng slides, pero I want you to become familiar with the slides and the topics so that mas mag-ease lang yung pagre-review ninyo kung paano kayo magfo-focus na doon sa outlines in your mind, no? So ang topics natin dito is yung the design and organization of health systems, and then the finance and the cost and benefit of healthcare choices, and then framing decisions in healthcare. So nakita nyo, no, kanina kinuwento ko sa inyo yung health system performance as understood based on the 6 pillars and the 3 outcomes. And then yung finance generation is discussed by Denise with you. And then ito yung di-discuss natin, the economics of healthcare, which is evaluating costs and benefits in healthcare choices. Now, after all these things, ang pinupunto nito is it allows you to now appreciate the rigor that is being undergone when you perform health technology assessments, which is the basic framework of decision making in health within the health system of the Philippines for deciding whether interventions have to enter into the health system market, no? Yung health technology assessment na palagi nyo naririnig at paboritong sabihin ng DOH and yung HTA. Pero when I try to listen in doon sa mga tao na medyo konti pa rin lang talaga nakakagamay ng what the HTA really is, no? Pero ayun, ito magiging conversant na kayo with the topic. Okay, health economics. So I'll begin with defining health economics and then some principles, no, on demand, supply, and production. So ano ba yung realities natin sa healthcare? Tumataas ang populasyon, humahaba ang life, at tumataas ang healthcare cost. So the demand for healthcare is really, really high. And yung traditional modes of financing, meaning provide what you can buy, is not becoming adequate. Kasi if you just consume without looking at the dimensions of equity, then the likelihood of you achieving the outcomes of the health system will be very low. Kasi halimbawa, the people who have the capacity to pay are not necessarily the most in need. So when we try to look at it on a very social perspective of healthcare, the models that allow us to consume healthcare will not allow us to really achieve the outcomes of the system. So in essence, health inequities continue to exist, no? So we need to have some way of deciding on how we should be shaping our healthcare. Bukod pa doon, um, there are new and more costly interventions that are safer and more effective, but not all of them can be afforded all at once. So, what framing do we have that will allow us to rationally choose between interventions? So, herein comes the topic of health economics. No? Ayan, bukod pa doon, other realities in... hello? May nagtatanong ba? Hello? Wala naman yun. Okay na. Wait lang. So, uh, there are lower income societies that have more considerations to bear, no? Like the Philippines. We are a low middle income country na nagiging MIC na, but the burden of diseases continue to follow us, the previous models where we have a double or a triple burden of disease, no, na infectious at saka lifestyle, and also disasters, parang yung the consideration of the burden of diseases around disasters and environmental causes. And then, yung systems natin are differently laid now, especially in the light of the new law. And oftentimes, ngayon, nag-evolve na yung ating system of acquisition of healthcare, pero majority pa rin talaga is out of pocket. And in the recent data, no, I think bumaba naman ang out of pocket expenditure ng Pilipinas to less than 50% na, pero ganun pa rin, no. It's still a significant a significant portion of your pocket, which can lead to inequities and also poor access. So the thematic problems in healthcare include scarce resources, needs that have no bounds, and decisions around opportunities and outcomes that are uncertain. So, one critical enlightening moment doon sa mga nag-iisip about kung paano natin pagdedesisyonan ng healthcare, sinabi ng mga initial experts around health economics, maybe we should treat healthcare as an economic good. No? So that we would really know, kasi there are rules around market that allows us to decide kung paano tayo pipili. No? Pero there are counter intuition around, well, we should not really think about prices in health because health is a right. No? So sinasabi nila na parang hindi dapat ang pagbigay ng serbisyo sa kalusugan ay nakabase sa kung magkano ang meron tayo. And it's unethical to think of healthcare as an economic good. But I think, I don't know if it's White that actually said na na it's also equally unethical not to consider the costs of healthcare, because we know that healthcare is is something that we need to procure. And if we now consider it as an economic good, we can apply certain principles around demand, supply, and also production that will allow us to achieve the most efficient consumption of healthcare goods. And that would be ethical in all in its overall overarching sense, no. And that's the reason why nag-evolve na yung topic ng health economics. And in essence, ano ba yung economics in itself, no? It's it's how individual and common decisions around how individuals make rational choices, no. And economic theories of decisions under certainty and uncertainty are so general that you have to distinguish between decisions that are deterministic or stochastic and also lead to broad areas of application. So ang dami yung ano no, mga mapabangong ano salita, pero in essence no, when you say deterministic and stochastic, there are certain dimensions that we can actually apply that will allow us to create decision rules. No? Yun yung ina-apply na makikita nyo doon sa mga economic evaluations. So for example, mga stochastic or deterministic measures is for every peso, how much healthcare improvement is changed. So for example, for every peso in TB program, how many TB patients are actually cured? So it becomes now a ratio or a deterministic ratio that allows you to decide between interventions na o ito pagka nagbigay tayo ng gamot sa TB, ang per peso, ito yung rate of outcome change. Pero kapag nagbigay naman tayo ng mga information dissemination, lectures around tuberculosis, tapos ito yung cost niya, pero ito yung nagiging outcome, we can now decide between different interventions by looking at deterministic dimensions of these interventions, which is costs and outcome. And yun yung basis din of a lot of economic evaluations. And ngayon, dahil economics ang pinag-usapan natin, health economics becomes now a branch of economics that is concerned on how resources are allocated and used within different health systems. And it draws on a lot of disciplines, no? Public finance, economics, public policy, statistics, medicine, and also public health. So that's the reason why I'm really enjoying the topic of health economics as well, no? Kasi when you begin to discuss public finance and public financial management, there are a lot of things that we can learn from it. And then of course economics, the decisions around scarcity, and then public policy on how we should translate decisions into regulations. And then how do we now look at statistics so that it becomes an information that feeds into the models of computation. And then of course medicine. Medicine and public health. When we begin to look at the epidemiology of disease and the patterns of disease, that allows us now to look at how much cost will a particular decision around healthcare, for example, let's give heart medications to people with heart diseases versus the epidemiology of death for people that do not take any heart medications but have heart conditions. So you now infuse all these, no, that's the statistical measures and then the medical medical presentations, and then the epidemiology of occurrences of certain of certain disease presentations, and then it allows you now to say, okay, this is how much this is the cost of not giving health medications as against the cost of giving heart medications. Okay. So why is it relevant? No, healthcare spending is becoming more and more substantial. No, we have bigger, especially in the light of SHF. Kapag binaba na yan, bilyon na ang ibababa sa bawat probinsya. Gano'ng kalaki na yung economic decisions na kailangan gawin ng bawat probinsya kapag nakakakita na sila ng mga interventions that they have to compare. No, we cannot just apply purely public financial management principles, no, na kung ano yung nauna i-propose, yun yung natin doon dahil yun yung meron ng patakaran. Hindi pwede yun. Kailangan makita natin what's the most cost-efficient intervention for the population. It's also a capital investment, and we also have to understand that health is not directly proportional to healthcare spending. That we know from comparisons between countries na nakikita natin, no, ang United States, they're putting in a lot of money but not necessarily becoming the healthiest country. And then we find countries like Cuba where doctors are being paid peanuts pero this intervention that allows them to have more doctors in the field is very low cost, pero it creates ripples in their health outcomes. Okay, and then of course that triangle, no, if we have better health outcomes, people will have better economic productivity, and in essence better becoming a better society. Okay. So sige, bago ako mag-proceed, any questions bago tayo ano? Ayan. Any questions? Malinaw pa naman? Okay, sige. Alright, sige, share again. Okay. Sige. Bakit tayo mag-aaral ng health economics, no? Kasi decisions around resource allocation lead to favorable outcomes. And then, of course, if we have clear decision frames, we become more rational, evidence-informed, and transparent and accountable for our decisions. And we will be able to manage the way the market behaves with an understanding of economics. So, ang fundamental concepts around economics are demand, production, and supply in healthcare. No? So, sa isang market, the market is essentially this mental idea of an arrangement where there are people that are providing resources, and then there are people that need to consume certain resources. And then the buyers and sellers have to engage into this physical space where they have to meet, or a physical or virtual space where they have to meet and communicate their purpose, so that the buyers can provide, I can gain from what the sellers are able to provide. No? And in essence, it creates mutual net gains. Ang ganda, di ba, ng idea na, okay, meron akong kayang ibigay na meron ka namang pangangailangan. So, nakuha mo yung pangangailangan mo, tapos ito naman kaya magbigay, kumita mula doon sa transaction. It's mutually beneficial. That's the concept of a perfect market. But it's it's more defined when we say a perfect market, kasi a perfect market is where the adjustment mechanism between supply and demand permits the exchange of goods and services without any need for government interventions. Ibig sabihin, utopian idea. No? Ang perfect market is where there is certainty, alam mo kung ano yung produkto at yung makukuha mo. There are no externalities. There is no extra benefit or extra damage or negative effect from consuming a particular good. You have perfect knowledge, no, from both sides of the supplier and the buyer, where you understand each other's provisions and also needs. And the consumers are able to act free, no? Ibig sabihin, there's no force that will that will compel them to consume certain goods that are against their needs, di ba? Minsan kasi ganun din naman, di ba? Pag merong mga market forces na sinasabi natin, no, na minsan alam mong masama sa iyo yung sigarilyo pero napapabili ka. Kasi there are certain influences, no, or actually externalities that are there. And then consumers are able to act free, but at the same time the producers also have to be many, no? Para the choices are rational, no? Kasi if there is only a few, or oligopoly or monopoly, kung saan iisa lang ang you have actual control over the freedom of consumption, no? So a perfect market is described this way, no? There's certainty, no externality, there's perfect knowledge, there's freedom of choice, and also there are numerous players. Okay? And a rational consumer then, so kaming mga ekonomista, no, we always talk about marginal measures, no. So a rational consumer is able to maximize the utility, no, na for every cost change there is an equal and corresponding change in its utility, no. So for every unit cost there's an equal unit gain, no. That's marginal utility. So in a perfect market, the consumer knows all the needed information to make that necessary choice. But in reality, nothing there's no perfect market. No one has all the information, especially around healthcare. Even doctors, as we try to dispense our healthcare to people, we know that our knowledge of the situation is only up to the history that was provided to us and the physical examination that we were able to provide. Pero in reality, patients might lie. There are certain predicaments around their social dimensions that we might not know, so that there is a probability that what we provided as an intervention might not be the most appropriate. But we don't have a perfect information. No? Pero a rational consumer and a rational producer would have all the needed information to make the right decisions. So, okay, nabanggit ko sa inyo marginal utility. So, utility is a unit of satisfaction. No? Kung ano yung nakukuha natin. So, a marginal utility is that extra satisfaction sa bawat unit of consumption. So, kada dagdag na piso, ito yung dagdag na nakukuha natin. Kada dagdag na gramo ng tsokolate, ito yung dagdag na pisong kaya natin ibigay dahil ito yung katumbas ng kasiyahan natin doon sa tsokolate. But there are certain laws that that exist within the market of demand and consumption and utility. So for example, marginal utility tends to decline kapag dumadami na yung nakukonsumo natin. So for example, nabanggit ko nga tsokolate. No? Sa lalong dumadami yung kinukonsumo natin tsokolate, hindi naman nangangahulugan na tumataas yung satisfaction natin sa danong dumadami. Siguro sa simula, nakadalawang tsokolate, tatlong tsokolate, sarap, apat. Pero may suya na yan. Masusuya ka na. Bababa na yung unit of happiness mo. No? So that's the marginal utility decline, no? And that's a rule that tends to happen in a lot of in a lot of marketplace, no? Kung saan may pattern na napapansin sa mga pag-consume ng mga tao and the level of satisfaction that they are receiving. And it's crucial because it allows you to understand certain behaviors, no, the value of health, the demand for health services, and the demand for certain health insurance, no. So kung meron kang isang insurance, you might be happy, but tatlo na yung insurance mo, there's sometimes baka maisip na ng mga tao, there's no utility for me having too many, no. Okay, another is demand. So demand is another fundamental concept around health economics. And demand is essentially the quantity that the consumer is both willing and able to buy. So there's willingness to pay and ability to pay. Kasi kung you may be willing to pay pero wala kang pera, then the demand will not react accordingly. No? So the demand curve is essentially the relationship between the price of an item and the quantity that you will be able to ask for that item. No? And in essence, there's also a law of demand. There is a pattern, there is an equation that we can really look at to predict demand. In essence, as the lower the price of a good, the greater the quantity that we will be willing to pay over a given period. So it's a declining slope. No? A declining slope is the law of demand. And we can predict the demand of people around certain goods. So before I proceed, sige nga, mag-isip nga kayo, ano ba yung mga common determinants of demand? Mga kaibigan, katoto, kahit sino magsalita lang. Please unmute. Ano yung nakaka-impluensya sa inyong pag-consume? Sa inyong demand?
Price?
Price?
Supply.
Supply. Yung presence ng supply, no? Ano pa?
Price of the product.
Price of the product. Okay. Ano pa? Sige. Natahimik na mga tao. So there are a lot of things that can actually influence demand for a certain good, no? The level of utility, yung direness of your need to consume, the presence of the good um, um, siguro forces like provision of it for free, no? So the demand will rise kapag libre, di ba? And also other things, no? And these things, these influences um, can be around the nature of the good, the predicament of the producer, the predicament of the consumer. That's the reason why this down slope is not present in a lot of the the consumption in healthcare, no, in a number of healthcare consumptions. So for example, if we are able to see a corresponding and a proportionate change in the price with a change in the demand because of the change in the price, then that's what we call elastic demand. Pero there are certain instances where there is inelastic demand kung saan a change in the price is disproportionate or smaller yung change in the quantity demanded. Ano kaya example no? Yung kahit nagbago yung presyo pero hindi nagbabago basta-basta yung konsumo ng tao. Sige, anyone?
Rice. Bigas.
Rice. That's a nice example, no? Kasi rice is is influenced by hunger, the need for the need for nutrition, no? So, minsan papapansin natin kahit tumataas yung bilang ng bigas, hindi basta-basta bumababa yung konsumo. Ang bumababa lang siguro yung yung pera ng tao. Pero tinatry pa rin nilang bumili. That's a very good example. Other things that can actually be inelastic is yung presyo ng gasolina, 'di ba? We still consume gasoline, we still consume electricity, pero kahit nagbago yung presyo, the demand for it doesn't really exactly change as against elastic demand. So, usually with elastic demands, yun yung mga generally available goods, no? For example, saging, 'di ba? Kung mataas ang presyo ng saging, ba't ka ba bibili? Di ba? Pwede magbago agad ang konsumo mo sa saging. Hindi naman yan essential to human life, no, or the daily activities of daily living, no. Pero hindi siya kagaya ng kuryente, no. Na kahit tumaas yung presyo, yung demand will always be the same. So the slope is not necessarily the same slope, no, following the law of demand. And there are certain things that are totally inelastic, no, na kahit anong pagbabago ng price, the demand remains the same. Meron ba kayo naiisip? Ano sa tingin nyo? Sige, pag-isipan nyo ha, pero I think you got the concept around elasticity of demand. No? So the elasticity of demand is that proportionality of that marginal cost and marginal change in the consumption, no. So kada taas ng presyo, ito yung corresponding pagbaba ng konsumo. Nagbabago siya, depende sa nature of the good, the nature of the consumption, the nature of the prices, the existence, no, of the goods, no, and a lot of other things that can be influencing demand. So why is it important for us to understand that? Because it also allows us to predict the behavior around consumption for certain goods, no, ng healthcare. For example, ang boob job, yung pagpapagawa ng malaking suso, it's not it's not tawag dito, it's not necessity, no. So there is elasticity in demand. So sa lalong nagiging mura ang presyo ng boob job, mas lalong dumadami yung nagpapagawa ng ganon, di ba? Kasi nagre-react siya accordingly. Pero hindi siya kagaya ng halimbawa sa nabubulok ng ngipin, no? Hindi porke na pagka nagiging mahal, tumitigil lang ang mga tao sa pagpapabunot ng ipin or ng filling, di ba? It's no, there's inelasticity in that demand because people will still try to consume that particular type of healthcare even when prices are high. So if you understand that, then you will also be able to understand certain abuses around the market, no? Na parang, sige, paano mo yan? Pagawa mo yan kasi the decisions of people will not be depending on the price. No? Okay. So ano pa yung natin, mga fundamental concepts, no? Rational producer. A rational producer is someone that's has knowledge around the cost of the good and also the utility of that particular good, so that you are a rational producer will maximize his profits given certain constraints, no, which is the cost, no. So hindi siya maglalagay ng sobra-sobrang presyo sa profit para lang maibenta ang If you are a rational producer, ibinibigay mo yung tamang presyo ng utility value ng So halimbawa, ito yung nakikita mong halaga niya sa tao, ito yung binibigay mong presyo doon sa halaga. Ayon doon sa nalalaman mo sa pangangailangan ng tao at kakayanan ng tao magbayad. That's a rational producer. Pero in reality, hindi ganun, no? Minsan, hindi pare-pareho ang perspective ng tao kung ano ang halaga ng isang bagay. Kaya minsan sasabihin ng isang producer, okay, tataasan ko yung presyo niyan. Kasi alam ko, para sa akin dapat ganito yung yung presyo niyan. Pero a rational producer would have knowledge of the people's ability to pay, and they will price it accordingly, given the constraint. Okay, so commonly it's the balance between revenue and cost, no? So revenue is the earnings per period of time for the sale of a particular amount. Tapos the cost is actually the cost of goods, no, which is the necessary payment for the owner's resources and efforts to provide a particular good, no? And a marginal revenue is that extra revenue gained from selling one more unit of a particular good. And then yung marginal cost is the opportunity you're willing to give up to gain that unit of good. So, kung patas yan at hindi sobra-sobra yung revenue for a particular unit of good, then rational yung producer, no? And that's the balance between rational production. But there are certain things in production that are present, no? So the law of diminishing returns. So usually in producing a particular good, sa lalong dumadami ang napoproduce natin, pamura ng pamura yung kailangan nating ipinapasok na cost para ma-produce ang particular good, no? Pero nagkakaroon din ng decline yan kapag sobrang overproduction na, no? Kasi kapag overproduction, there are wastage, no, that are higher na kapag overproduce. So in essence, production has that law of diminishing returns, that productivity are typically looked at based on the point at which the production is at in its highest efficiency, doon sa gitna, no. Pero once it diminishes now, where you are producing more than this necessary for consumption, then the returns will be negative now. Then you have to stop at the point where you're just producing what is gonna be consumed. And that's very important for a lot of market players, no. Hindi ka pwedeng produce na tapos wala namang magko-consume mo. Bababa ang returns mo, tumataas ang cost mo. Okay. Supply. Sa supply naman, time check lang ako, 8:19. I'll stop sharing lang kasi baka mahaba pa. Any questions? So far malinaw?
Yes po.
Okay. So these are just fundamental concepts, ha. These are
Yes,
not
Doc.
central but they are very important for you to appreciate the next topic. And then yun sa next topic, until what time tayo pwede? 7:32 hanggang anong oras kayo? Alas 9?
9:30. Sabi.
9:30. Sure. Sige, basta gising pa kayo ha. Baka nire-record nyo lang yan tapos tinutulugan nyo na ako. Ano? Ah, sige. Okay. Sige, ko-continue ako. A few last slides na lang on the foundations of health economics. Sige. Okay. So, ano naman yung supply, no? Kanina, di ba na-produce na-discuss na natin ang demand. Na-discuss na rin natin ang production. Ngayon, i-discuss naman natin ang supply. So sa supply, supply are the quantities provided by all producers of a product at each possible price over a given period of time. So ibig sabihin, there is a time element, there is a quantitative element, and usually when we see, naalala nyo, di ba, yung downsloping curve ang tawag pero diretsong linya lang siya. Yung downslope ay the demand curve. Pero usually with supply curve, this is dependent on the suppliers, di ba? The supply curves shows the relationship between the price of an item and the total quantity that is being supplied by a producer. And commonly, the law of supply is the higher the price of a good, the greater the quantity that the sellers are willing to make. Diba, syempre, mas tataas ang kita mo sa lalong mataas ang presyo ng ng good, no? So, kapag mas mamahalin tapos alam mo mas nakukonsumo yan sa mamahaling presyo, gagawa ka ng gagawa niyan. So, the law of supply tends to have an upslope, no? So, pagka na kayo sa law of demand and supply, ganyan yung explanation natin, no? Any contracture or bends in that curve of the supply means a change in the relationship between the price and the quantity. And in reality, healthcare is able to follow the laws of supply and demand. Kaya the theory around healthcare is an economic good makes sense, no? Kasi the lower the price of the healthcare, the higher the demand. And the higher the price of healthcare, the lower the demand. But there are certain violations to this market reality, no, or market utopia. No? Sometimes in healthcare, the prices fail to account for the cost and the benefit needed to produce or consume a good. Ibig sabihin, meron certain externalities or other things that influences the cost or the consumption of a particular healthcare. But the importance of understanding the law of supply and demand allows us to now theorize what would actually violate yung laws of supply and demand. And any violation to that law of supply and demand where you have a rational producer and a rational consumer na kung saan nagbibigay ka ng care at pinipresyo mo siya ayon dun sa pangangailangan ng tao at kaya na ng tao para magbayad, kapag na-violate yung law na yon, then that's where government interventions have to be set, no? Because these are market failures, no? And this market equilibrium where there is a perfect perfect point where the price of the good is equal to the willingness of the consumer to buy, and the quantity that the suppliers are able to produce is equal to the demand of the people for that particular good. And this market equilibrium sets at the meeting point between the law of supply and demand. So kapag nagbago yung curves na yan sa posisyon ng equilibrium point, ibig sabihin, meron lang tayong certain violations to the perfect market. And yun yung pinagbabasihan namin to compute now, base dyan sa figure na yan, to generate certain equations around, okay, meron tayong napansin na parang nagbago doon sa sa consumption, na parang, teka, bakit parang ang supply is endless, tapos kinukonsumo pa rin ang kinukonsumo ng mga tao kahit ano pang presyo. So, we'll have to look at, what is violating the law of supply and demand. Okay. Alright. Sige, yun yung first lecture on fundamentals of health economics. Any questions before I proceed to okay, so malinaw naman siya, no? Move na tayo doon sa using those concepts. No? Sige, try natin ma-cover siya in 30 minutes. Health econ. Okay, kasama po ba nangyari? Ayan, sige. Sige, Christy, ano yan?
Naisip ko lang po yung nangyari doon sa problema natin sa TB cartridges na parang anisip ko kasi ang naging violation was the monopoly of the supplier na ang taas po ng demand pero parang na-hold up tayo na kahit mataas yung demand, hindi natin siya mabili ng mas mura kahit yung sa ibang countries mas mura yung bili nila kasi iisa lang yung supplier natin. Na 'di ba parang sa perfect market dapat may choice tayo ng pagbibilhan pero dahil sila lang yun po wala tayong magawa. Ikaw ba hindi siya yung norm na sana mataas yung demand, bababa din sana yung price niya.
Agree, di ba? So nakikita nyo yung appreciation natin ng perfect market, no? It's very useful to understand healthcare as an economic good kasi it allows us to learn about the violations in the laws of supply and demand. At kailangan siya makorek, di ba? Hindi pwedeng gano'n, no? It's becoming an irrational consumption, no? Pagka gano'n, kapag may monopoly. And I'll show you some of the, let's have a very, very quick discussion. It's a good segue to the next topic, no? Before tayo mag-move to economic evaluation, mag-segue tayo dito sa topics ng, ng mga violations of the perfect market. Okay. So, luma na ng lectures na to. 4 years ago. Okay. Goodness. Nakikita niyo na? Speak up.
Yes.
Nakikita na ba? Okay, sige. So, efficiency. So, part of the goal, the intermediate goal of health systems is efficiency, no? So, we need to, the perfect market efficiency is that equilibrium point between law of supply and demand. So kapag meron kang ganun, you have the perfect market, no? And any change is a change in the efficiency of the market and shows market failures. And what do we do with market failures? Government interventions, right? So the perfect market paradigm allows us now to appreciate the certain things that we need to do to intervene to create rational decisions around healthcare. And ayan, recapitulation, alam niyo na yan, blah, blah, blah. So ano pa yung natin sa description of a perfect market? Very rational, self-interested yung patient, and profit maximizing yung provider, no? So ibig sabihin, siya, no? It's a good relationship kasi the patient is interested with their own concerns and then the provider is able to maximize their profit based on the need of the self-interested patient. And there's no provider and payer split, no? Ibig sabihin, purchaser provider split na kung saan may paghihiwalay yung nagpo-provide at nagpo-purchase kasi that changes the dynamics in the perfect market. And homogeneous yung product, ibig sabihin sa pagkakain, lahat ng mga nagpo-produce ng tinapay, kumbaga, hindi siya unequal na yung isa nito, yung tinapay niya ay ang need naman ng mga tao is makakain ng tinapay pero yung isa dito, yung tinapay niya mayroong cocaine, yan nakaka-addict. So tapos yung isa naman dito walang So in a perfect market essentially dapat pare-pareho din, there's equivalence in products. Actually, ina-apply natin yan sa pharmacy, di ba? Dapat there's bioequivalence na kahit ano pang paracetamol yan, basta paracetamol yan, okay yan. Hindi na yung parang tatanungin pa, ano ang best paracetamol para sa atin? Kasi alam natin na they're bioequivalent and it provides the same effect. No? And there's complete information as well in the perfect market and the sellers can easily enter and exit the market, no? so that continually there's a change and an improvement in the products that are being produced. So the efficiencies, of course, competitions will create prices that are low. Good competition also creates quality. Consumers can also maximize their utility because of choices, and then they can predict future costs because there are no violations to the law of supply and demand. And then the buyers know for sure what, and they can plan around their consumption because they are not blinded to what they are consuming. But in reality, there's no perfect market. No? So um, in healthcare, there are states, individuals, and firms that purchase the healthcare. Hindi siya unlimited purchasers. And the sellers of healthcare are hindi din unlimited, no? Certain areas, iilan lang yung doktor na kaya magbigay ng healthcare. So, the choices of people will be very limited to the people who are able to provide, no? Kahit ano pang ibigay nilang presyo, no? The services are also limited, the knowledge of people are also limited. The prices of healthcare, especially around market dito, hindi sila transparent, no, around the cost of goods, no? Gaya sa a lot of businesses, no, hindi nila sinasabi yung mga secret ingredient kung magkano ang presyo nun. Pero in a perfect market, everybody has perfect knowledge na what you're selling is exactly what I need, and what I'm willing to pay is exactly what you're willing to receive, no? Um, and then the quality, is a good, in a perfect market, is a good is a good prompt for you not to consume. Pero in reality, there are certain areas in healthcare where even if the quality is bad, you have no other choice but to consume. And then there's no excess production in perfect market, but in reality, sa atin, merong excess production in certain healthcare goods. So in essence, all these realities in the healthcare needs intervention. No? And market failures occur when the price systems fail to allocate the resources to achieve allocative efficiency. No? What do we mean by allocative efficiency? It's when we are able to attain all possible mutual gains from the exchange. No? Pero dito, kapag hindi niya nagagawa yung mutual gains, then there is allocative inefficiency. Okay? So ano ba yung mga market failures? No? Ang market failures is when it is a public good. No? Ibig sabihin, the demand for a certain thing is not dependent on the price itself. No? So for example, vaccines. No? Vaccines for certain for certain diseases have to be considered as a public good. No? Especially when we want people to be healthier. And it cannot be dependent on the price. It has to be provided by right. No? So it's a market failure to sell vaccines, especially when it's important to the whole population. It has to be considered as a public good, as a public intervention. Another failure of healthcare is externality or spillover. It can be positive or negative, meaning between the exchange of the good, you are paying more than what you are, or you are actually, getting more or less than what you asked for. For example, yun nga, the negative externality of sigarilyo. Pagka nagbenta ka ng sigarilyo, hindi siya nakabase doon sa sa presyo ng mismong nikotina na na-enjoy mo. In reality, may other cost pa yon na hindi mo na malayan. Nung bumili ka nun, actually, maari bumili ka din ng hospitalization, no? Na hindi mo alam na yun sa konsumo mo while you spent about 20 pesos for a cigarette, you didn't realize na, oh, teka, yung consumption ko na pala yun ay meron pang ibang presyo, price over healthcare, no? So that's a negative spillover or negative externality. Addiction is also a negative externality, no? That has a tendency for you to consume more without your rational choice, kasi napipilitan ka na by your own nicotinic receptors na parang okay, kailangan ko bumili pa ng isa pa. asymmetry of information or imperfect information is also a market failure. No? And commonly, asymmetry of information happens between an exchange between doctors and patients because there is technical ascendancy or there's knowledge ascendancy of a particular doctor, no, around medical concerns, and then the patient naman has a symmetry of information about their own healthcare reality na maaring hindi nila sinasabi sa doktor lahat, no. So this asymmetry of information, this allows a good exchange. So what's the typical intervention? Minsan nagkakaroon tayo ng mga insurance contracts, no, na parang dapat pagkapapasok ka, sabihin mo na muna kung ano yung mga conditions mo para bago tayo mag-agree na ito yung ibibigay kong serbisyo sa iyo. Baka mamaya naman magbabayad kami o na magpa-purchase kami ng healthcare good para sa iyong kalusugan, pero hindi namin alam na sa presyong iniligay namin, marami ka pa palang sakit na hindi mo sinabi. So, asymmetry of information also has to be attended to. And then, yung sellers cannot easily enter and leave the market, especially when there are limitations in the numbers. No? So, a major concern is the limitation of human resources, no? Which typically ends up with inefficiencies in the system. No? Kasi hindi natin nakukonsumo yung best provider. Ignorance and uncertainty around price, supply, and demand because halimbawa, no, there are uncertainties around production, ganyan. Magkakaroon din yan ng change in the price. For example, uncertainties in terms of the contents of a particular good, or uncertainties like, for example, the change in demand due to disasters. No? Okay. Okay pa kayo? Sorry, baka nagbablabber na ako. Okay pa?
Yes po.
Okay. Alright. Sige. So, yung equation of the perfect market, of the perfect law of supply and demand, also becomes the equation for social efficiency. So, the theory around healthcare is an economic good. Kapag patas ang demand at supply, there is social efficiency. So there is social benefit for every social cost. At kapag in-apply natin siya, yung it's the marginal private benefit is equal to the marginal private cost, and also the marginal social cost is equal to the marginal social benefit, no? Parang pinalitan lang natin yung pangalan ng mga linya diyan. Pero the point is, for every change in the social cost that the community is paying for, there is an equal and commensurate change in the social benefit kapag na-apply ang market efficiency sa healthcare in a health system. So, anong itsura ng public good? Ang public good is when more than one is able to receive benefits from a particular good. It's a non-rival and it's also non-excludable, meaning the goods are consumed equally by everyone whether you like it or not. So, ano yung market imperfection ng public good? It's non-rival and non-excludable kasi may free rider problem. Merong nakakakonsumo at nagigain from the consumption na hindi naman nagbayad doon. So, unfair din yun, di ba? So, ang example ng public good, alam nyo na? Sige nga, magsabi kayo isang example ng public good, non-rival and non-excludable. Anyone?
Law enforcement.
Yes, that's nice. Could you explain?
Kasi po lahat naman po ang kumbaga no one is atang nito. Lahat po magfa-follow kasi law po siya.
So siguro baka mas maganda yung perspective around sa law enforcement na anyone is more than one person is able to benefit from law and order, di ba? So it's non-rival. Whether sumunod ka, nagbayad ka ng buwis mo o hindi, pagka nag-apply ng law and order, nagbe-benefit ka kahit non-taxpayer ka. So non-excludable din siya kasi anyone can equally benefit from peace and order. Right? Pero, hindi mo naman siya pwedeng sasabihin, okay, hindi ka pwedeng hindi ka nagbabayad ng buwis, pwede ka ma-hold up dyan. Wala kami pakialam. Hindi natin magagawa yung ganun. So the tendency is, we have to treat law enforcement as a public good now. Kasi we cannot really exclude anyone. And when it becomes a public good, then the government has to answer for it. No? Because we cannot really exclude it, we cannot create mutual benefits from every mutual cost. And hindi siya mapapasok sa perfect market, no? So mangyayari lang yan, there are abusers of the system, no? Na kung sino pa yung nagbabayad, hindi naman siya yung pinaka nagbe-benefit, no? Lahat nagbe-benefit, so merong ibang hindi magbabayad. Ang tendency nun, hindi na rin magbabayad yung iba kasi okay naman pala eh. So ano mangyayaring intervention? Let the government take over. Let it be a public good. Right? Sige, externalities naman tayo. Sa externalities is the adverse and beneficial uncompensated spillover. No? Ibig sabihin, hindi siya kasama dun sa exchange, pero kasama, hindi siya, outright kasama na sasasabi dun sa exchange between the healthcare good. Pero, epekto siya. No? It can be positive or negative. Or, meron din tayong caring externality or altruistic benefit of consumption. Pero, we have limited time to, So, paano siya mangyayari niyan? Di ba nakita nyo, alam nyo yung perfect market, di ba? If we are going to look at positive externality, an unpriced byproduct of production or consumption can create a change, no? So, nakikita nyo yung, marginal private benefit at saka marginal social benefit. So, sa bawat pagkonsumo mo, makikita mo na sa may diferensya doon sa level ng social benefit, no? So, ibig sabihin halimbawa, mas tumaas yung cost sa bawat quantity na nakukonsumo ng particular good. And nagkaroon tayo ng movement in the in the equilibrium. So yung pagtaas nito at ang pag-change niya from the marginal private benefit, an individual consumer able to get the individual benefit, pero pagka at the level of society, nakita natin na yung iba nagkakaroon ng gains nagkakaroon ng cost from the interaction of the exchange of good. Kapag nagkaroon ng pagkakaiba yung benefit ng isang tao doon sa konsumo niya as against doon sa benefit ng society, that's an externality. That's a shift in the curve. So yung space between that is the welfare loss. No? So ibig sabihin, for example, vaccination. Ang marginal private benefit niyan is kung ilan yung nabakunahan, kung equal siya sa marginal social benefit, yun din yung bilang ng lahat ng mga tao na protektado. Pero in reality, ang marginal social benefit ay mas marami. Kasi kahit 95% lang ang magpabakuna, yung 5% kahit hindi sila magpabakuna, protektado na sila. So yung social benefit is not equal to the private benefit. So there is welfare loss. No? There's a positive externality. May gain ang society dun sa konsumo ng iilan. No? Ganon din sa medicine research, sa home safety alarms. Diba? Ang home safety alarms, merong ibang makakarinig, naging safe na rin sila. So may social benefit dun sa private consumption na nangyari. So that difference from that perfect market reality ay nagkakaroon ng change or welfare loss. No? Bakit tinatawag siyang welfare loss? Kasi siya yung benefit na hindi na ipasok doon sa cost of producing the good. So yung producers ay hindi nakakuha ng pagpepresyo doon sa nag-gain ng society. So, halimbawa kung malaking-malaki yung welfare laws or yung social benefit, mas maganda talagang gobyerno na ang sumagot. Kasi 'di ba? Kawawa naman yung bibili kasi palaging sila yung sumasagot sa nabe-benefit ng iba. Sa negative externality, ganun din, no? There's a shift in the curve as well, no? In terms of the social cost, no? Like, for example, cigarette smoking. Yung marginal private consumption mo or cost, ikaw lang yung bumili. Pero dapat, ang bilang din ng mga taong nagkakasakit, yung cost nun, ay ikaw din lang. Pero in reality, in a society where the private consumption of cigarette leads to certain changes din sa sakit ng ibang mga taong suffering from second-hand and third-hand smoke. So the cost is actually burdened upon other people for your own private consumption. So there's again a welfare loss. There's no equal and rational exchange kasi sino yung sasagot ng pagkakasakit ng iba? Ilalagay ba natin sa presyo ng sigarilyo mo yon? Yun yung kailangan ng gawa natin ng paraan. Ganon din sa drunk driving, pharmaceutical waste dumps, mga ganon. Makikita nyo na ikaw yung nagkonsumo pero maraming nakukonsumisyon. That's a negative externality. Okay. So, asymmetry of information. It's another market failure, no? Yung adverse selection, moral hazard, supplier-induced demand, and cream skimming, no? It's where yan yung mga types of asymmetry kasi nagkakaroon ng pagpili, no? When one party in a transaction has better information and it's used to their advantage, creating selection, creating moral hazards, or supplier-induced demand, gaya sa mga doktor, di ba? Parang, sige, bigyan mo lahat sila ng pa-x-ray. Hindi naman nila alam kung kailangan nila yan, eh. Parang ganon, di ba? And cream skimming, yung pagpili din, no? So, makikita nyo yan, yung market of lemons, aralin nyo na lang, kasi limited na yung time natin. Pero, meron din tayo, ayan yung mga changes in the curve. And may change din sa curve ng moral hazard kasi the changes in the consumer behavior or the provider behavior is based on the presence of an insurance, no? So there is dead weight loss. Ibig sabihin parang meron tayong welfare loss. Kapag doon sa moral hazard, for example, you take more risk when you know that someone else will cover, no? Or moral hazard exposed. It's consuming more goods when you know that someone else will pay. So, ang tendency nun, it creates a change in the shift of the social welfare. Kasi ang insurance is based on the cost of a society average consumption for a particular condition. Pero kapag alam mong sasagutin ng iba, ang tendency mo hindi nakabase dun sa average consumption mo. Binabago mo yung ugali mo. So, it becomes a moral hazard and it creates welfare losses. Okay? Ganon din sa supplier-induced demand, no? Where there is a principal agent problem where the provider has more superior knowledge. So, ang tendency niya is pwede niyang i-abuse yun na parang sasabihin niya, okay, mag-essentially forte ka pa, magpa-liver, ultrasound ka pa, yung ginagawa na napakaraming mga doktor ngayon para magamit yung kanilang mga mga isinusupply ng kanilang mga med reps. Kasi mas marami silang alam para hindi alam ng patient na parang hindi ko na magkano kailangan yan. So the demand is induced by the supplier. Ang cream skimming naman is when there is intensive competition and the producers will find more favorable groups that will exclude the high-risk individuals. So for example, ang cream skimming is, halimbawa, magbebenta ka ng insurance mo, pero namimili ka, di ba? Mamimili ka ng mga taong walang sakit. So, mas, ang nananalo doon is the house itself, no? Parang ikaw mismo na nag-produce ng, ikaw yung nag-gain most from it. Kasi yung mga taong pinipili mo is not likely the ones who are gonna use the insurance. But how do we now create a change in that? If you have a social health insurance where you don't cream skim, no, lahat And then the prices of the goods that we will purchase will be based on the average consumption, predicted consumption of a particular healthcare. So, alam niyo na rin naman ang imperfect competition, yung monopoly, oligopoly, oligopsony, and monopsony. At kung paano siya nagkakaroon ng change in the market curves of supply and demand. So, pwede niyong aralin siya. And the role of governments is that, for every market imperfection, we can correct the efficiency of the system by adding interventions, that will restore efficiency and equity, meaning social benefit and social costs, the balance between the social benefit and social cost. Hello. So, anong example ng mga ginagawa ng gobyerno? Direct government involvement in healthcare, in financing certain goods. They can correct the externality by, for example, adding the cost of the externality to the consumption, pagpapataas ng presyo ng alcohol, ng sigarilyo, ganyan. Regulating the markets so that there will be enough competition, and also if there is limited competition, you regulate the price of that oligopsony or monopsony, and then you can also provide more information to create more rational and bounded decisions. Okay, sige. Napapahaba na tayo, ha. So alam niyo na yan. Hindi na ako magpapakompute na I doubt na papacomputing kayo nila ng formula around yung pag-compute ng welfare losses. Pero yan, ganun ang ginagawa namin usually with economics, alamin natin kung magkano yung nawawalang welfare loss for a particular exchange and change in the perfect market. Okay, I'll stop there. Okay kayo? Malinaw naman? Okay, good. It's 8:52. Do we have enough time to discuss economic evaluation? Okay pa kayo? Okay, sige. Try natin, ha? Uy, sige. Tingnan ko yung lecture ni sa inyo, ni Dante. Nakikita niyo yung screen?
Yes.
Alright. So, ito yung lecture sa inyo ni Introducing Economic Evaluation. 2019 lecture pa namin to. So, dito, there are various models for evaluating economic decisions, and there are advantages and disadvantages, and we try to refrain from saying there is a higher type of economic evaluation, dapat ito ganito or ito ganito. Ang namin is that a particular model of economic evaluation is based on the type of evaluation, the type of information that you need. Not all economic evaluations will be treated equally. All economic evaluations can be treated equally. Not one is superior to others, and I think the crux to that decision is it appropriate? Is it an appropriate type of economic evaluation yun na apply to the decision making that you need to do? So may certain techniques to economic evaluation, and may mga practical examples dito si Dante. Okay. So sa kanya, ang outline niya dito is grounding around economic evaluation. what it is and the concepts around it, and also how do we now use economic evaluation. So medyo bibilisan ko lang to para we'll have some time for your questions. So there are economic evaluations tries to make a balance between two fundamental concepts on efficiency. Number one is technical efficiency, which is looking at doing things right. No? Ibig sabihin, are are the things that we are providing the best option based on cost, cost to benefit, no? Na ibig sabihin, ito ba yung uh, pinaka hindi cost efficient, no? Ang technical efficiency is bang for the buck, no? Yung pinakatamang presyo or pinakatamang cost doon sa pinakakailangan mong ma-deliver. Allocative efficiency is about doing the right things, no? Is it worth doing? So it's another dimension to economic evaluation kasi oftentimes, di ba, with scarcity and economists, kapag dinidiscuss lang ang non-health economists, typically would just look at ito ba yung pinakamura for a particular output, no? Pero sometimes when we add another dimension, which is allocative efficiency, the dimensions of equity becomes another decision making framing, no? Not everything you have to also look at the cost to delivering or to covering more populations, no? So that's doing the right things, no? So sometimes it's more costly pero you are able to deliver to more people, and then in the end it's more allocatively efficient, no? So nagkaroon ng additional dimension to decision making, not just the the direct cost of a particular good. So, ang economic evaluation is the process of identifying the costs and outcomes between alternatives, no? So, it's comparative and very important talaga na you have to be able to identify what are the costs that you're going to talk about as to whether the intervention or the effects of a particular intervention or the cost of a particular condition, dapat these information are available to you. Because once you have identified the intervention or the alternatives of a particular condition, for example, not giving X-ray versus giving X-ray versus, giving 3 X-rays or whatever, these alternatives have to be now compared based on the costs. And if it's just compared based on cost, then that's technical efficiency. But it's allocative efficiency when we now compare it to cost versus outcomes. Gaano karami yung health benefit na napoproduce niya. So now your comparison becomes a ratio, no, between cost and outcomes. And then it's easier now to compare marginal differences. Ibig sabihin, unit differences. What's the cost per unit outcome? Yun nga, di ba, sabi ko sa inyo, kami mga health economists, mainly kami mag-talk about marginal changes. No? So, yun yung tinitingnan natin dyan. So, pagka there are no alternatives compared, and you're just looking at costs, then the healthcare evaluation that you're doing is a cost description. Kapag wala kang pinagkukumpara, tapos tinitingnan mo lang yung outcome, then it's outcome description. Tapos pagka both, pero wala kang naman pinagkukumpara, then it's cost and consequence description. So it's important to have these for particular for a particular intervention. But when you combine these things, no, these individual descriptions, and compare it against each other, and if we're just looking at costs only, then we're doing cost comparison, and we're just looking at cost efficiency. If we are looking at outcomes alone, then then we're looking at effectiveness, no? So it's an effectiveness evaluation or allocative efficiency, no? Pero if you combine cost and outcomes, it becomes an economic evaluation. So it's we're comparing between the amount or the cost of the intervention and the marginal effect nito, no? And we are able to compare it between interventions for as long as we are talking about the same outcomes, no? And that is economic evaluation. Alright. Lagpasan natin to. Ito yung mahalaga. Okay, how do we now make comparisons in an economic evaluation? So there's a new intervention. For example, we have two interventions that we're going to talk about. The new intervention and the standard of care. So for the standard of care, magkano yung ginastos natin para to provide it, no? And then how many people are actually, or how many people are benefiting from that standard of care? Or for example, what's the success rate of this particular standard of care? Then it becomes, I don't know, for example, if we are comparing um, facility-based delivery versus home births, no? So a facility-based delivery costs about this much, and then the survival rate of mothers is this much. So the cost per survival is ganito. So new intervention is home-based delivery with assistance. So tinignan natin magkano ba ang home-based delivery with assistance, yung nagpalagay ka pa ng mga swimming pool sa bahay mo and ganyan. And what's the, and yung magkakaroon ka ng sariling nurse and ganyan, all the cost of that. And then what's the survival rate of mothers? So what's the cost per survival? So then you are able now to compare the incremental cost effectiveness ratio, no? Yung difference between the cost and outcome ratio of the new intervention and the standard of care. And then it makes a more certain decision doon sa box. But of course, we are just measuring cost and outcomes. There are certain uncertainties that we may not be able to predict. No? So another dimension to economic evaluation is to also identify what are the uncertainties that we are that we may not be considering. For example, an uncertainty around um, yung inflation rates, no? So we can measure inflation, parity of costs, pagka napipredict natin siya, no? We identify that particular uncertainty and then we measure the uncertainty between no. So kasi halimbawa, yung cost pala na tinutukoy natin na sa standard of care is in a particular country and at a particular time period. So the inflation cost of a particular monetary unit is not the same with the new intervention that is currently being So sometimes we do measurements like that. Pero in essence, yun yung ginagawa natin, no? When we say ICER or incremental cost effectiveness ratio, titingnan natin ang diferensya ng total cost and total outcome of a particular intervention versus the standard or the comparator, the total cost and total outcome of the comparator. And the difference is the ICER. If you have a positive ICER, in essence, more likely you have more incremental benefit for a particular intervention. And that allows you now to decide that an intervention is more superior than standard or more superior than a comparator. Okay. So, ayan, may mga ganyan tayo, no? Robotic surgery, mass vaccination, and genetic tests versus standard of care. So, siguro, ewan ko kung anong particular comparison ang ginagawa natin dito. Pero if I'm going to think about this, mass vaccination, robotic surgery. So let's presume this is parang predicting newborn diseases, newborn care disease. So pwede na merong congenital defect. So we're going to compare the cost of having to perform robotic surgery or vaccinating or doing genetic testing so that we can look at newborn the cost of newborn care and how many newborn conditions are actually being amended or being attended to based on these interventions. And if we are going to look at all the costs, we have to consider cost of capital outlay, training, scale up, vaccines, training, deployment, o pagka sa genetic test, yung testing, administration, education measures, uh, to measure all outcomes and then adverse outcomes. So, ganun tayong maghanap ng costs um, that we will put into the equation to create the ratio of cost and outcome. And then once we have that, we look at the incremental cost ratio in comparison to the standard of care, and then whichever has the highest ICER would be a favorable intervention. Okay? So, ganun ang ginagawa sa economic evaluation. So, ano ba yung mga cost and outcomes being measured sa iba't ibang uri ng economic evaluation? Kapag there are about 6, no? Pero the 4 main economic evaluations are cost-benefit analysis, cost-effectiveness analysis, cost-utility analysis, and cost minimization analysis. All right? So again, when we do economic evaluations, there are 2 dimensions that we're looking at, the cost and the outcome. So the outcome of a cost-benefit ratio is the monetary savings, no? The monetary benefit. No? So ibig sabihin, ang ano mo dyan is sa cost-benefit analysis or CBA, ang cost mo is, of course, monetary, yung numerator. Yung denominator mo is also monetary, no? So for every cost of, for example, let's do a cost-benefit analysis of sabihin natin X-ray for pneumonia, no? So, ang cost-benefit analysis na looking at what's the cost of a particular, iniisip ko Sige, makakahanap ako ng well, sige, let's use that example, no? The cost of a particular X-ray and the cost of the benefit of hindi bagay yung example. Pero anyway, nothing comes to mind. Nag-weekend setting na yung utak ko. Pero in essence, kapag ang denominator mo is also monetary, then a cost-benefit analysis will allow you to create comparisons between the net cost of A versus the net cost of B, no? And that would be the net benefit, no? So, kung mas malaki ang natipid mo, at presyo yung nakitang itinipid mo, then that's a cost-benefit analysis. No? It's a form of economic evaluation. Hanap ako ng example ng CBA. Excuse me. Anyone before I can anyone think of an example for cost benefit analysis?
Doc, like parang buying a Gen Expert machine.
Right, that's good. All right. So yeah, what would be the cost numerator and then the cost denominator natin?
Siguro yung price nung machine and then the ano ba yun? Yung mga cartridges na gagamitin versus dun sa mo walang parang ganun lang with other hospitals ba?
Okay. Yeah, that's a good comparison, no? So we're gonna look at the cost of having having a gene expert machine versus MOA, no? So titingnan natin ang net cost natin dito is teka, punta tayo sa cost benefit natin is titingnan natin yung cost of having the buying the gene expert, ima-minus natin doon sa cost of having MOA. Probably the other cost that we have to consider doon sa MOA is yung halimbawa agreements, transportation, and all that. So, tapos nakita natin, mas mahal talaga yung presyo ng gene expert. So, ibig sabihin, the cost benefit analysis elicited dito instead of a benefit 120 million net loss if we're going to choose gene expert versus MOA. So the CBA result says na kailangan ang choice natin is to do MOA. Parang ganun, no?
Kung titingnan naman po natin, Doc, yung benefit ng meron kang sariling gen expert, like yung very efficient na kahit iba matitest na, and then di na ikaw makikipagpila, mas marami kang makukuhang mga positive cases ng TB. Parang sa benefit cost naman po ba yun?
Yes. So that's a very good no? So therein lies naman how do we now do costing, di ba? How do we now do valuations? So it's very important to set rules around valuations. So sa isang cost-benefit analysis, for example, na ginawa natin kanina, sinabi mo, when we say looking at the social dimensions or social perspective of cost, then we begin to look at what are the other costs pa na kailangan natin i-put into the equation. So ilagay natin lahat yon. Tama yung sinabi mo. Sige, ano yung cost ng pagpapatayo? Ano yung cost savings ng pagkakaroon ng sarili versus yung nagbabayad tayo somewhere else? Ano yung cost ng maintaining the material? So once we have all these dimensions of the cost, then it allows us now to compare the dimensions, the more comprehensive dimensions of cost of the other intervention. And then once you compare it, and you have the the monetary measurements, the monetary comparisons between the two, then you now have a clearer cost-benefit analysis. So very crude lang yung ginawa natin kanina, pero tama yung sinabi mo on doing valuations. And ganun din ang ginagawa natin for all others, no? Whether it's a cost-effective analysis, cost-utility, or cost minimization analysis, no? Okay. So tama yun. That's good. We have that for an example, no? So sa cost-effectiveness analysis naman, is that clear? Okay tayo doon? Sa CBA? Alright. Sige. Sa CEA naman, cost effectiveness analysis, meaning we have the cost, and then we also have the natural units of the outcome being measured. So for example, we say survival rates of mothers. That's the natural unit, no? Or we can say the percentage of fully immunized children. Ganyan. So those are the outcomes being measured based on its natural unit. And then the cost effectiveness analysis is looking at similar natural units. For example, for a particular intervention, like smoking cessation, basketball, and sports introduction to sports, and hospitalization. The natural units that we're gonna look at if we're talking about the effects of tobacco is lung disease. So the number of lung COPD cases thwarted or prevented. So i-compare natin ano yung cost of setting up of providing patches. What would be the cost of setting up preventive measures through sports like basketball, and what would be the cost of just treating COPD, and then comparing the COPD cases prevented versus the actual cost of each intervention. Then this comparison allows us to now know the number of COPD averted per cost. So that's a cost effectiveness analysis. A special type of CEA is the cost utility analysis. So, ano kaya yung ano nun? Ang cost utility analysis kasi allows us to compare between different interventions, entirely different interventions, but looking at qualities as a standard unit, no? Or yung ano no, uh, as a standard unit of comparison. So, tingnan natin kung meron ako ano. Why is it important to have ano no standardized units? Kasi not all the time the the things that we are comparing are related interventions. For example, um, what if we are comparing between cancer care institutes versus setting up a cancer care institute versus tama ba yung ginagamit ko na ano? Sige, pagpalagay natin yun, no? Compare, hindi, siguro hanap ako ng ano, quali, ano. Sige, CUA. Actually, may slide pala dito si ano, no? Ba't ko pa nilalayo sarili ko? Punta na tayo dun sa slide ni ano. Capital approach. Hindi na naglagay ng example ng CUA si ano, CBA lang. CBA, okay, CA. CUA. Alright. So, ang CUA example ni ano is apologies ha, medyo nag-ano tayo. Hindi nagbigay ng specific example dito si ano, si Dante. Okay. Alright. Sige, I'll try to come up with an example here. Anyone, habang naghahanap ako? Naghahanap din kayo?
Cancer patients, chemotherapy or surgery for breast cancer.
That's a good that's a good example. So chemotherapy versus surgery. So sometimes it's very difficult to find common outcomes, no? Or comparable outcomes between two types of intervention. So chemotherapy versus surgery. We'll now look at a more standardized a more standardized outcome, which is a quality adjusted life years, which is based on a measure that quality adjusted life years, or Petrin Dali, or disease adjusted life years, which looks at quantifications of certain activities of daily living that are being evaluated for each intervention. So, meron tayong mga certain scores like yung EQ5D, SF6D, and these are kumbaga calibrated calibrated tools na that are able to look at various interventions based on its effect on people, no? And the questions that can be asked for each instrumentality ay meron dito example ng yung ito yung ginagawa yung EQ5D ni Sir John Wong. They're trying to create a DALI measure, a quality measure for for the for Filipinos, no? The Philippine So titingnan dyan, for each intervention, how does it affect the quality of life of the person in terms of mobility, safe care, self-care, usual activities, and pain and discomfort. No? And these measures will allow you now to compare between different interventions kasi various interventions will affect our quality of life. And the quality of life is a good standardized measure um, between different interventions na for each cost, ano ba yung nagiging effect niya sa quality of life ng mga tao. And it becomes a cost utility analysis, a special type of cost effectiveness analysis. No? Bakit utility? Di ba kanina, ano yung definition natin? Utility is a unit of satisfaction. No? So, we need to measure the level of satisfaction. A standardized tool will allow us to really measure it based on various dimensions that are relevant to a particular intervention. No? So, may iba't ibang uri ng tools na pwede mong gamitin for the different interventions. And if we are going to compare yung mga ano nga yung nabanggit mong example kanina?
Yung surgery versus chemotherapy.
Yeah, all right. So surgery versus chemotherapy, in the study, we start looking at the valuations of cost between the intervention in itself, magkano din yung cost of opportunity losses, the disease, the absences, the death, lahat yun tinitingnan natin to measure all the cost of a particular condition. And then we then measure a particular set of population on the quality values for each intervention. So commonly available na yung values na yan in the net, no? So for example, surgery for a particular condition, ano yung qualities na makikita natin na equivalent doon sa type of intervention. Pwede mo nang gamitin yon to create your incremental cost effectiveness ratio. Na ito yung overall cost, ito naman yung overall outcome, overall utility, utility value. Tapos pwede mo na ipag-compare yung ICER nung mga yon kapag meron ka ng mga utility values for the various interventions. Okay, bago ako maging magulo kasi medyo nag-struggle lang tayo with coming up with examples kanina. Any questions bago ako maging hindi naman naging magulo sa inyo? Clear naman? Okay lang. O sige, okay si Jazel, si Ching. So okay naman, no? So so far we have discussed three. No? Cost benefit, it's when you're comparing between monetary values. Cost effectiveness is when you're comparing the cost and the cost per natural unit or parang healthcare indicator as a basis to compare between interventions. Pero what if various interventions are not related to similar healthcare indicators? Then we have to find a common effect or outcome that we need to measure. And therein comes cost utility. Cost utility analysis is a special type of cost effectiveness analysis that looks at quality as a standardized outcome measure for various interventions that may not relate to a particular healthcare indicator, to a similar healthcare indicator. And by actually having quality values for various interventions, it allows you now to easily measure the ratios of cost and quality, cost and outcome for various interventions, and allows you now to compare, diba, more rationally. There are also simple ones, no? Simple ones, simple economic evaluations that are also present apart from the three that I mentioned, no? So ano pa yung ibang natin na alam natin? Cost minimization. So it's very simple naman kapag sinabi natin cost minimization, no? Ibig sabihin, magkapareho kayo ng outcome na pinag-uusapan, ang pinagkakaiba lang is yung cost. So for example, ang pinagko-compare natin ay interventions na nagpapababa ng timbang no? So, ibig sabihin parang weight loss. Yun yung comparable outcomes natin. Tapos, ang pinagko-compare na lang natin is alin yung mas mahal na weight loss intervention. So, ibig sabihin, halimbawa, ang cost minimization natin ng halimbawa exercise versus liposuction, di ba? Titingnan na lang natin ano yung weight loss per versus cost. So dahil alam natin na dapat similar yung natin kino-compare na outcome. So for example, 50 kilogram weight loss ang pinag-compare natin. To do a 50 kilogram weight loss, sa ganito yung ginastos ko sa liposuction at ganito naman ang ginastos ko sa exercise. So, alin yung cost minimal? E di yung makita nyo mas mura talaga. Kung nakita nyo ang exercise ay mas mura para lang malusa 50 kilograms, then do cost minimization analysis. I choose ano nga tawag dito? Exercise. So, another type of economic evaluation is cost consequence. Sa cost consequence naman, for a particular cost of a particular intervention, nililista mo lahat ng consequences niya. It's just a narrative of all consequences. And then you try to make comparisons between the various outcomes that are present, and it allows you now to evaluate between interventions. So now, what's the importance of the various economic evaluations? Knowing the various types of economic evaluations allows you to utilize the easiest way of evaluating between interventions. So for example, what you have is a monetary or monetary units to be compared. Then probably what you can do is cost benefit analysis. But if you do have available information around utility, like quality values of a particular intervention, then it would be very good to actually perform a cost utility analysis. The importance of a cost utility analysis is it allows you now to do some global level comparisons or national level comparisons between interventions, because commonly countries are looking at quality adjusted life years as a measure of comparing between interventions. How much does it change the quality of life of people? So to really decide between interventions. So the various types of economic evaluations will be very useful once you now enter into the realm of doing health technology assessments. Kasi sa health technology assessments, there are layers or frameworks that are being used to really decide between interventions. The first is clinical effectiveness studies. So the clinical effectiveness studies are the randomized control trials, the RCTs, and ganyan. We have to be able to only compare between the interventions that have been scientifically validated, whether it's an RCT, whether it's another type of clinical efficiency study, then a clinical effectiveness study. Then once we have that list of interventions that have clinical effectivity, then we now move on to doing economic evaluation. By doing an economic evaluation, we are now able to use that outcome measured by the clinical effectiveness study against the cost of that particular intervention. So once you have that, you can perform an economic evaluation. But there's an additional layer that will now be added to the decision frame of health technology assessment. So apart from that, we now look at various dimensions that you need to compare in health technology assessments, like equity, household household impact to household cost, household impact, yun yung term. And then the responsiveness of a particular intervention to to the population. So ano ba yung acceptability ng intervention? So it's not just technical and allocative efficiency ang tinitingnan natin. We also have to be looking at other dimensions to create a proper assessment, and that's the dossier of the health technology assessment. And since we don't have time to really discuss health technology assessment, I'm hoping na makakapagbasa kayo doon sa HTA. But hopefully, itong review on the economic evaluation and the fundamentals of economics will allow you now to better digest the materials. Alright? Sige, isa-stop ko na dito bago tayo malula. Any questions? 9:30 na. May tanong ba mga katoto kapatid?
Ay, Doc, magsalita na lang po ako. Grayson.
Yes.
Ito po. Doc, in terms po siguro of, I would have to say weight or impact when you do the analysis, are they or created equal? Yung sabihin, when you do your presentations, parang is one preferred over another? And I mean, for example po, di ba, when we do sa mga HTAC, di ba, the RCTs are considered di ba po, di ba? Kumbaga siya yung pinaka, I would have to say, powerful or the one that is the most credible and in terms of weight compared to other types of studies. So when it comes to dito po, sa evaluation, are they all equal in footing? Or when we do presentation, kumbaga one is considered more, has more weight compared to another?
Not necessarily that way kasi tama sa clinical effectiveness studies we have a hierarchy of studies, no? The highest is the RCT, and then the lowest is probably a case analysis, no? It's different with economic evaluations because economic evaluations will really depend on the availability of data. So if you don't have quality measures for certain interventions, what you might end up with is a CEA. No? Kasi most common is yung studies that are present that measured the cost and outcome of a particular health outcome, whether it's number of lives saved or deaths averted. Yun yung mas common na present doon sa mga studies, no, kapag tumitingin tayo. In reality, sa mga data natin sa sa DOH, ano yung present? Which is yung FHSIS. So, mas common sa atin na data available for us is the cost of the intervention kung meron tayong actuarial studies, and also the indicators. They have indicators that are being collected. And QALY is actually, kailangan mo pang intentional study talaga yan to really search the QALY values unless may available ng study that actually performed the QALY valuations for particular interventions. Sadly, konti pa lang yung Asian and Filipino studies that really look at QALY measures for intervention. So the transferability of data sometimes is not really that well fitted. So the uncertainties have to be laid down, and halimbawa, this is taken from data from this time and from this country. And ganyan. Very important yung transparency of the evaluation. So yeah, doon pagdating sa economic evaluation, it's not hierarchy but rather appropriateness.
Okay. Sige po. Thanks, Doc.
Any question pa? Magpapadali na yung basa nyo dun sa iba. At least mas madali na yung review nyo dahil na-review na sa inyong concepts. Alright, tingnan ko yung chat kung meron chat dito. Chat sila yan. Okay, infrastructure project. Do we always have to use all types or can we favor one type of evaluation to gain support from external? Okay. Economic eval usually is just one. No, you don't have to use everything. And if you have a cost utility analysis, or likely you don't need to do other things now. Kasi yun yung most difficult. I think in terms of difficulty, pinakamahirap ma-perform ang CUA. Okay, any other? Lana? Okay. I'm hoping na magamit niyo yung materials na makapagbasa-basa kayo for whatever we may have missed. And hopefully makatulong din ito sa inyo. Yeah. And nandito naman kami ni Denise kung meron kayong questions. Apologies kung hindi namin mare-replyan agad kasi we're not always available. Ayun. Yun lang. And over to May kung gising pa siya. Andiyan pa ba sila May? Sila Shirley. Tulog na. Ayan. Okay, maraming salamat. You're welcome. Ayun, sige. Good luck sa inyong compre exam. Sana maintindihan yung yung mga review nyo. Okay. Maraming salamat and happy weekend. Okay. Bye. Pwede pa akong mag-ano. Alis na ako Hindi ko alam wala na naiwan na HHRDB. Bye-bye.
Thank you, Doc. Thank you, Doc. Bye.
Thank you, Doc. Naintindihan ko na yung binasa ko.
Sige. Alright, bye.
Good night, classmates.
Good night, everyone.
you.